Hi, Dr. Laurel Griffin here. Today I want to talk about occipital neuralgia. I've had a handful of patients come to me lately with that diagnosis that is usually a medical diagnosis. What occipital neuralgia means is the irritation and possible injury of the nerves at the very top of the neck that go up into the back of the head, the occipital region of the head. This applies directly to what we do here in the office because when the atlas misaligns, usually goes up and turns, it's going to irritate the top two nerves of the neck that go up into the occipital region. And that's what we do, is we correct the misalignment of the neck so that it gets rid of the irritation on those occipital nerves. And we do that every day. And that, whether it's an extreme case that is burning, stabbing, throbbing, or if it's an ache, that's what we do. And I want to show you here, very top of the neck here. This is your atlas bone right here. This is the back of the head right here. In fact, here's what it would look like right there. The two nerves that are involved in occipital neuralgia, C1 nerve root, C2 nerve root on each side, they come together about right here and they form a ganglion, which is a nerve bundle, and those nerves will go up the back of the head. That's where they are creating the occipital nerve, and then they also go down. When the atlas tips and or twists, which it usually will do both when it is out of alignment, those nerve roots are irritated. They swell, they burn, they're painful. They're painful to touch, they're painful when you turn your head, they're painful sometimes when you just sit there. What we do is we do a series of, first thing we're gonna do is examine the patient and see if they are tender here, if we can feel the swelling on the nerve roots, the tension on the muscles, etc. Then we actually go through and do a series of very precise digital x-rays so we can measure exactly how the bone is out of alignment. With the atlas orthogonal work, we don't do any twisting or popping. It's absolutely not necessary because we are extremely precise and gentle. There's no need to go in there and cavitate the joint. We do it very precisely within the normal range of motion of the joint. We will correct the misalignment. But we go in and we measure exactly how the joint is misaligned, exactly the slope of the joint, so we know how it's going to move for correction. And we can correct the misalignment of the atlas bone that was causing the nerves to be irritated. That's what was causing the irritation on the nerves. So when we adjust a patient, before we adjust them, we're going to check those nerve roots and they're going to be tender. After we adjust them, that tenderness is gone immediately. And you can talk to any of the patients that have been here. That's how this technique works. If that's how we know that it is incorrect alignment, we go and do the scanning palpation afterward. As the doctor, I don't feel the tension anymore. I don't feel the swelling anymore if it's in the right spot. And as the patient, you don't feel the pain anymore. And that's how we do what we do with the atlas orthogonal work. If you want to hear more about that, give us a call, 515-224-1093. First part of becoming a patient here is to have a screening consultation so we can determine if you actually are a candidate for care here, to find out if this is something that could help you. There is a way to correct the cause of occipital neuralgia. I know if you look up medically how to treat occipital neuralgia, that says their goal is to try and combat the pain. They try to fight the symptoms with various drugs, physical therapy, etc. We get rid of the cause of it. You can't get rid of the pain if the irritation is still there. So that's what we do for patients. If you think you might be a candidate for that, if you think that you may have what I'm describing here, please give us a call. We can most likely help. And I would love to see if we can. You don't have to live with this anymore. So that's what we have for you today. Have a great day.